I can cut it out. Hey everybody, this is John Oxley, and I'm with Mark Taylor today. He's another physical therapist that works here at HPT. Like I talked about last week, we're going to start highlighting some of our therapists and then specifically some of the conditions and that we treat and programs that we have. One of the most common things that we see, or specifically Mark sees, since he sees a lot of our knees, is arthritis of the knee. It's a really common condition. A lot of people have questions about it. And so I thought I'd bring Mark on today and just talk to him, ask him some of these questions, and give him the responses, or him give the responses that he gives to his patients. So let's get started. So give an overview. What is arthritis kind of in general, and what does it mean for the knee?
Arthritis in the knee, as in any joint, is basically a wear and tear process that occurs over time. If you have arthritis, it's probably a good sign in that you've been on the planet for a while. But it's a little wear and tear, and it occurs primarily dealing with the joint surface. In our knee, we have a couple of kinds of cartilage. We have a wedge of cartilage in our knee that acts as a spacer between those two bones. But we also have cartilage that lines the bone itself, so to provide a good gliding surface. And particularly the wear and tear on that gliding surface, that articular cartilage, is what we're most concerned about.
So often I feel like we get patients, they come in, they've got let's say they have recent knee pain. You tell them that they have arthritis and they say, well, I didn't have this knee pain before, so why has it started now? Did the arthritis just start? What do you tell people when they kind of come with that complaint?
And you know, it is really pretty common. The foundation was probably there. They may have done something to exacerbate that, to bring that on, to flare that up. Again, it's the wear and tear has proceeded over time. That may have been made worse by the fact that maybe you've had an injury at some time in the past that's sped that up for you in your particular case. But usually something sets it off. It's the proverbial straw that kind of breaks the camel's back. The condition has existed. You've just made it worse by something. Activity, maybe something you're used to, but maybe you did a little longer. But even more importantly, what do you need to do to maybe help manage that?
Well, that was going to be my next question is, so what things do you give people or advice do you give people that have some knee arthritis to get it better?
You know, when we look at those issues, it normally boils down to mechanics. You know, there comes a time in all of our activity life that we need to prepare to do the activity, not just do the activity. So maybe you've been playing tennis for years, but it's starting to bug you. Well, maybe we need to do some things to improve your motion, improve your flexibility, improve your quad strength, your hamstring strength, or maybe your endurance so you can play longer. So normally it's a mechanical issue in fixing some of those things. Joint motion, flexibility, strength, endurance usually is the first line of defense to help manage those things.
And usually, I mean, the exercises I feel like that you give people, they're pretty straightforward and easy. It's not brain surgery, but you got to be consistent with it.
The hardest thing about them is forming the habit of doing them. They're really simple in the beginning, and it doesn't take a lot of time. You know, again, you have to prepare to do those things you want to do, whether it's tennis or golf or walking your dog or whatever the case might be. Maybe you need to do a little additional work so you can do what you want to do. You practice your sport, or your activity, let's do some things to help you improve your ability to do that.
Well, you know, everybody likes to look on the internet, and in fact, that's where they're seeing us right now, is on Facebook. And there are lots of options for these arthritic knees. So they can go to the doctor, get an MRI. Everybody knows about having your knee scoped, arthroscopy, steroid injections, lubricant injections, physical therapy. What kind of order, what advice do you give people on when and what order to do those things in?
Well, you know, we'll oftentimes see people as the early stages of this. And if it looks like something fairly straightforward that we can manage with exercise, we'll advise and instruct accordingly. But it probably should begin with contacting maybe your primary care physician or your orthopedist it's a good idea to at least start with an x-ray. Make sure there's nothing out of the ordinary going on. You've ruled those things out. Yeah, you have a little arthritis, and let's work on managing it. Some of those other things are great tests, but you don't necessarily need to do those in the beginning. You know, a plain x-ray for a knee, for example, is a good place to start. Now, if you question other things might be occurring, torn meniscus, or if you have other issues with ligament structures, then maybe some other tests might be indicated. But maybe just a visit with an x-ray, rule out something unforeseen, diagnose the fact that, yeah, I do have some wear and tear, and then manage it accordingly.
So let's say we've got a patient, they come in and their knee is pretty worn out, and you can tell that. What kind of criterion do you give them to say, okay, it's time to have a total knee replacement, let's not drag this knee around any longer? At what point do you feel like people should be making that decision?
You know, oftentimes the patients we see at this stage have usually seen the orthopedist. The old advice that went along forever was, as long as you can stand this pain, hang in there and, you know, keep your
Hold on as long as you can.
And you know, I think we're all probably guilty of saying that in the past. I tell patients that, you know, the pain is one thing, but if you're losing function, you know, people who have their knee replaced, if they wait so long that it's gotten tight, so tight that they can't get their knee straight, or they can't flex past 90 degrees, then that makes their post-op course a lot tougher. I try to advise people that, you know, when this starts really interfering with your function, maybe you can manage the pain, but your bony surfaces have changed to where it's affecting the soft tissue and affecting your function, then that's probably the time you want to do that. Not hold on so long that now post-operatively we've got so many other things to fix versus just get your motion and strength back. So I'm more conservative about that than I used to be.
Well, hopefully we were able to give you a little bit of information on knee arthritis. If you have any other questions or comments, you can send them over on Facebook. You can also call the office, ask for Mark. He'd be happy to answer any questions and talk to you about anything that you have going on. And we'll be back next week and highlight another therapist and another program that we have here at HPT. Thanks.
Thanks.